My name's Mel Recchia. I'm a registered prescribing nurse and I'm the clinical lead for Aurora Skin Clinics and Cosmetic courses, and I carry out all of the injectable non-surgical treatments. I'm going to talk today about the 8-point lift. The 8-point lift is a procedure that we use to restore the natural volume to the face once the aging process has kind of started to take hold. So the 8-point lift is essentially a series of injections using hyaluronic acid dermal filler. Hyaluronic acid is a substance that's naturally found in the skin, and it's what gives the skin its youthfulness and its plumpness. And when we're young, we have lots of it. It's also in our joints for moisture. But as we get older, we start to lose the hyaluronic acid. So hyaluronic acid dermal fillers can be injected to replace the volume. Volume loss is a natural process of aging, and it happens to everyone, and typically the areas that we start to lose volume will be the mid-face or the cheek area. When we're young, we have lots of hyaluronic acid in here. We also have fat pads that are in certain places. As we get older, those fat pads start to become thinner, they start to drop, and it typically leads to the kind of the flatness that we see in the cheeks, and it leads to the nasolabial fold and the crease that comes down to here. It also leads to the what we call the pregel sulcus, which is a little shadowy area down here, and it leads to the kind of jowly effect that we see. So by restoring the volume in certain areas of the face, we can help to lift the skin kind of back to where, not necessarily back to where it came from, but we can restore that youthful volume and make everything look a little bit less aging. So typically the areas that we will treat to help restore this lift and volume will be area 1, which is the upper cheekbone or the zygomatic bone. Area 2 is the cheekbone area. Area 3 will be just here in the centre of the cheek area to just restore that volume. Area 4 is actually what we call the alar groove or alar triangle, which is at the top of the nasolabial fold. Area 5 is just in here. This is the oral commissure, and this leads to what we call the marionette line. This area here, we lose volume here, so it starts to become a little bit sunken in here, and the corners of the mouth can start to turn down, so we put some volume into here. Area 6 is down here, which is known as the pregel sulcus, and this is where you just start to find that the muscle here just starts to pull down, and we get a sort of a jowly effect. Area 7 is the angle of the mandible or the jaw, and then area 8 is this central portion of the cheek here. What we're aiming to do is recreate what they call the triangle of youth. So when we're young, everything is wider at the top. So we have wide eyes, full temples, wide cheeks. As we get older, the triangle of youth turns into what they've called the pyramid of age. So everything starts to become a little bit heavier down here. So what we're trying to do with these non-surgical techniques is to restore that width at the top of the face. So using the 8-point lift, we can address these various areas that we know and how they age, and we can start to replenish some of that natural volume. It won't take 25 years off of you, but it can just restore a slightly more youthful facial appearance. So if this is a procedure that interests you and that you think it will be of benefit to you, you will need to come along to see us for a consultation. Consultations are completely free of charge, and we will spend time with you and have a look at your face and have a look at the areas that you feel need attention, and we will sort of give you a prescriptive plan for what will be the best way of dealing with your situation. So yes, just contact the clinic and you can make an appointment with any of our nurses, and we can explain the procedure fully to you and how it may best benefit you.